Hi everyone, my name's Kayla, and today we're going to be learning a little bit about Parkinson's disease. Alright, let's get started. So just a general overview, Parkinson's disease, also abbreviated PD, is a chronic degenerative neurological disorder. It affects about 1 in 100 people over the age of 60. It affects 1 million people in the US alone and 5 million people worldwide. The average onset of this disease is age 60, but it has been diagnosed as early as age 18. So how does Parkinson's disease work? So PD affects dopamine-producing neurons in the central nervous system. These neurons are chemical messengers that are responsible for transmitting signals to help coordinate movement. There's a region in the brain known as the substantia nigra, where the substantia nigra cells produce dopamine. So people with Parkinson's disease have a loss of cells in this area, and this loss of dopamine causes neurons to misfire, and individuals with PD have a lessened or decreased ability to control their own movement. So you can see in the illustration in the bottom right, it shows healthy neurons compared to neurons with Parkinson's disease. So the top neuron, you can see the little red dots of dopamine funneling down and transmitting to the second neuron. In the healthy condition, you can see a lot of red dots funneling down and creating that strong communication between those two neurons. And in the neurons on the left, with Parkinson's disease, you can just see a little bit of dopamine funneling down, and there's very weak communication between those two neurons. So this is why individuals with Parkinson's disease have a tougher time coordinating their movement. So some signs and symptoms. Symptoms typically develop gradually and progress over time, and it's important to remember that signs and symptoms affect everybody with this disease differently. But some of the most common symptoms include tremors, slowed movement, limb rigidity, postural instability, cognitive impairment, like issues with memory and higher brain functioning, mood and sleep disorders, difficulty swallowing, smell loss, speech impairment, and unexplained pains. So you can see in the illustration in the bottom right how these symptoms manifest themselves physically. So if you're looking at someone who's diagnosed with this disease, you will notice that they look very rigid. Like this man, his elbows are flexed and he looks kind of stiff. He has stooped posture, and he's not taking wide steps. He has sort of a shortened gait and does sort of more of a shuffling than he does taking full strides. And you can see he's kind of trembling and probably having issues with balance as well as he's trying to walk. So some risk factors associated with Parkinson's disease. There's no known cause for this disease, but doctors believe, like most other conditions, it's a combination of both genetic and environmental factors. They have found in some research, in very rare cases, there's a genetic mutation of the LRRK2 gene, and this gene mutation has been the largest genetic contributor to PD, but again, it's only found in rare cases. So age is probably the largest risk factor associated with this disease. The older you are, the more likely you are to develop Parkinson's disease. Men are also at a slightly higher risk than women, and this is unknown why. So it's unclear. Medical professionals have been researching, but it still remains unclear if it is one or several genes that can contribute to this disease, or if it has more to do with the environment, like exposure to chemicals or toxins. And since the cause for this disease is unknown, there's not really one universal preventative option for stopping the progression of this disease. So early onset Parkinson's disease. There's a common misconception out there that this disease is an older person's disease. It is typically diagnosed in individuals that are 60 years of age or older. However, a lot of times symptoms can start at age 50 or younger, and when this happens, it is referred to as young onset Parkinson's disease, or YOPD. 10% of individuals with PD of their cases would be considered YOPD. So people with YOPD experience their symptoms a little bit differently. So their symptoms usually develop more slowly. However, since they're diagnosed at a younger age, they do live with this disease longer. They're also more likely to experience dystonia, which is an involuntary muscle contraction that leads to abnormal or painful posture. They're also less likely to have difficulty with memory and balance, as individuals who get diagnosed older would have issues with those things more. So diagnosing this disease can be a little difficult. Typically what happens is individuals will start noticing the most cardinal signs of the disease, which would be the resting tremors, bradykinesia, or slowness of movement, limb rigidity, and postural instability. So the nature of these symptoms usually will cause people to seek out a neurologist. From there, a neurologist will conduct a thorough check of their family and medical history, and then as well as complete a neurological exam. During these exams, doctors will look for 2 or more of the common symptoms, and then a lot of times, in order to verify the accurate diagnosis, they'll see how these individuals respond to drug treatment for Parkinson's disease. A lot of times, if they're not responding well, uh, they can kind of tweak and fix their diagnosis from there. Another thing to keep in mind with this disease is that misdiagnosis and delayed diagnosis are very common, especially in individuals with young onset Parkinson's disease. A lot of times it could be dismissed as something like a sports injury or arthritis or something of that nature. So it may require several tests and several healthcare professionals in order to reach the accurate diagnosis of PD. One other thing that's kind of cool is in 2011, the FDA introduced something known as the DAT scan, which helps to show the dopamine system in the body. This can be used to help verify a diagnosis, however, it cannot be used to diagnose PD on its own. Some treatment options. So there's no known cure, but the goal of treatment for Parkinson's disease is basically to improve functional status and protect against further neurological degeneration. And the treatment options are pretty similar no matter the age of your diagnosis. Drug therapy is pretty common for most cases of PD. However, younger people are less likely to start medication if their symptoms are mild. There's also surgical procedures out there. One of the most common ones now is deep brain stimulation, which sends electrical stimulation into damaged brain cells and will help to decrease some of the symptoms. Deep brain stimulation works best for controlling motor symptoms. Management and medications. These are kind of the 2 most common categories. The first one is dopamine replacement therapy, and the most commonly prescribed medication for PD is levodopa or carbidopa. A lot of younger individuals use this medication. However, one thing to be concerned about is long-term use can cause dyskinesia, which is uncontrolled involuntary movements of the body. So doctors are kind of at a standstill here whether to start this medication early to help control symptoms and maximize quality of life, or to avoid it and kind of avoid the motor complications that are involved with the long-term use of this medication. Another popular option is dopamine agonists. These medications will mimic dopamine in the brain. The long term is less likely to lead to severe motor complications. However, it may be less effective than levodopa would be. And this is available in pill form, skin patch, or injections. The injections are commonly used as a rescue therapy, however. So if you're not responding to any of your other treatments, a doctor might prescribe an injection of a dopamine agonist. Exercise. Should individuals with Parkinson's disease exercise? Is it safe? The answer is yes. It is actually highly recommended for individuals with PD to exercise. Due to the nature of the disease, these individuals are prone to physical inactivity, which can actually further degenerate and progress this disease. So it's important to, seek out a healthcare professional first to determine your level of functional fitness, and then they can lead you in the right direction for exercise prescription and whatnot. In moderate and severe cases of this disease, it's recommended to exercise under supervision of a healthcare professional, but with mild symptoms, get started right away, light to moderate exercise. It can actually help reduce complications related to the disease, such as osteoporosis, depression, and sleep disturbances, and it can overall postpone cognitive deterioration and slow the progression and symptoms of this disease. Exercise testing is not necessary, but it's recommended in severe cases. Special recommendations and considerations to keep in mind: if you're having difficulty with balance or coordination, avoid treadmill tests to avoid falls and stuff like that. And certain medications, just be aware of how they affect blood pressure and heart rate response. So you don't need a stress test if you want to get started with an exercise program. You can use the CD4 recommendations for functional fitness testing, which include a 30-second sit to stand, 4-meter gait speed, 30-second step test, and 30-second arm curls performed with a 2-kilogram mass. Case study. So we have a male who is 62 years old, non-smoker, normal blood pressure, normal BMI, normal cholesterol, blood glucose levels. His father was diagnosed with Parkinson's disease, and he himself was diagnosed with Parkinson's disease at 59 years old, kind of right around that common age for diagnosis. He is taking levodopa to control his motor symptoms, and he is physically active. He walks at a light intensity for 30 minutes, 3 days a week. So for this individual, we would recommend aerobic activities, low impact, walking, swimming, cycling. If he's having, difficulty with balance and his medication isn't working well, at certain times, stationary bike is a great option, or seated exercise as well. You can perform 30, 60 minutes a day, 3 to 5 days a week at a moderate intensity. Resistance training is also great. Standard body weight exercises, resistance machines, light free weights. We recommend this 2 or more days a week at a 5 out of 6 on a 10-point exertion scale, and target all major muscle groups. Balance and flexibility is also highly, highly recommended for individuals with PD. Static stretching to target all muscle groups. Hold each stretch about 15 to 30 seconds. Incorporate some stretches that challenge balance as well. And if balance is really an issue that day, use a wall for support, especially if you have a history of falls. So here are some great links for some more information. Parkinson's Foundation, the Michael J. Fox Foundation, both really awesome resources if you're looking for more information on Parkinson's disease. The link in the middle is the ACSM Health and Fitness Journal, and it's just a study that is talking about the benefits of exercise for Parkinson's disease, so you can look more into that as well. And then here are a few of the links that I use. Some great information here. Well, I hope you all learned a lot, and thanks for listening.